I mean, you've been talking here with Mr. Clark from Kissito and Atna about the deaths. And there's a whole bunch of, not large numbers, but there are deaths from obstetrical deaths. And what is there about the deaths that distinguish the patients who die from the patients who do well and survive in your hospital?
In our hospital, we do have two ways of expressing patient. Means that, purely our follow-up. Means that from the first day of antenatal care visit up to the end, we do have our follow-up claims.
Mm-hmm.
But in case of death, let me say something. Any patient we do have days. That days was not our antenatal care follow-up client, because she came referred from another hospital. And then, as Sipara is the place where everybody rests, everybody, get places in cost-wise and every situation. And all Christianity also matters.
Mm-hmm.
And then, we receive any patient who comes. For example, a case of whom I was mentioning was a patient who was referred from another center.
Mm-hmm.
And then she couldn't get any place. In private, it was damn expensive.
Yeah.
In many ways, they cannot afford to do so. In government hospital, maybe lacking of bed, and she came. We received that patient because she was exhausted, she with dry tongue and dry lips, and then that patient we received and started to help him. Finally, the final outcome was, even though it's so not good, but we did it our best for this individual.
So you're really saying that when you've seen the patient from beginning through delivery, so far no deaths, but all your deaths since you've been doing this at this hospital have been people who've been referred, basically come in later, and their antenatal care has perhaps not been as good as it might have been.
At least, if the patient or the client has antenatal follow-up in our center, in each visit, we alert them.
Yeah.
If, for example, if a patient with previous scar, if she comes, we'll inform her that blood is necessarily should be given, because any scar can bleed, or maybe uterine rupture will occur. For that reason, we alert them. They follow us, and then we prepare in psychological and in all aspects our cases. For that reason, the missing life in our cases is very, very rare, or I can say it's absent.
Yeah, it's interesting. You also said that if you come to this hospital and you don't have money and you're sick, you take them? You admit them?
Definitely. What we'll do is, we'll see the condition of the patient. If he is not able to pay, if she come in fully stage, we should have to admit. First of all, we should have to save the life, and then if they are capable to pay, they do. Unless otherwise,
It's very interesting because our hospital, Boston Medical Center, sees everybody, and they have a motto. It seems to me it's very applicable here. The motto is excellence without exception, and anybody gets the same care. And the same hospital that people, recent immigrants go, I go to. I had part of my lung taken out last year. I went to the Boston equivalent of Sipara. Thank you very much.
Thank you.